Nicole Thomas is a dental hygienist and a mum to a child with autism. Nicole wanted to find out how access to high street dental services could be improved for autism families. Nicole was supported by the team at Peninsula Cerebral Research Unit, a childhood disability research unit at the University of Exeter Medical School, and Professor David Moles at Plymouth University Schools of Medicine and Dentistry. Taking a child to the dentist can be very stressful for both the families and the dental professionals. It is thought that 90% of those that access special care dental services should be able to access their local high street dentist. This includes children with autism. So why don't they? Studies looking into ways to improve visits for children with autism were mainly from the dental care professionals' perspective. A study in America reported that 70% of the dentists asked did not feel confident treating children on the spectrum, with some choosing not to see patients with autism. What can we do to change this? Who better to ask than the experts? The parents. We carried out a qualitative study and asked 17 parents of children aged 4 to 13 with autism or a working diagnosis of autism living in the southwest of England what it was like taking their children for a dental checkup. This included what did and didn't work well and how they thought it could be improved. There was a varied range of good experiences, bad experiences, and those that are still a work in progress. This may not seem like a very high number of parents, but when there are no new insights than those already mentioned, it is time to look at the findings. We found that 5 factors needed to be present to increase the chance of dental checkup success. The flexibility of the dental environment and team, confidence of parents to advocate on behalf of the child's individual needs, continuation of service beyond the dental examination, clear referral pathways to specialist dental services, all linked together with clear communication. The well-documented sensory issues associated with autism were discussed by all parents, with some leading to potentially serious reactions from the children, including sickness and seizures. However, in addition to this, there were more difficult to explain sensory reactions. These came in the form of strong responses to a person's physical appearance and/or their mood. When this was pursued, parents explained their children were highly attuned to the emotional environment and body language, which led to challenging behaviours. We termed this as hyper-empathy. Parents described how the clinical nature of the setting was challenging, with particular focus drawn to the dental chair, as a challenge in itself to sit in, a pressure for parents to conform to, and a self-imposed measure for a successful visit. The waiting room was viewed with similar anxiety, having to sit next to strangers, the busyness of the area, and the time waiting for the appointment contributed to a heightened anxiety detrimental to the outcome of the visit. For some parents, a great deal of energy is required in the preparation, which despite best efforts, still did not mean they arrived for appointments on time. This compounded the stress as they faced possibly being turned away. Equally, if the dentist was running late, they had to make the difficult decision of whether to abandon the visit as their children became increasingly agitated. Parent confidence was undermined when parents assumed the dentist's education had provided enough training to deal with children with additional needs. Parents consequently didn't feel they could question the dentist when issues arose. Some parents, despite confidently advocating for their children, experienced reluctance from the dental team to make minor changes. Therefore, despite their best efforts, dental visits were largely unsuccessful. Dental teams that took time to respond to the needs of the children that were expressed by parents had more positive experiences. This highlights the need for flexibility of the dental team. Checkups were also positive when the whole dental team became involved in the care of the child. Helpful strategies included providing information on what to expect before a checkup and making thorough notes so parents did not have to repeat themselves at every appointment. This continuity before and after a checkup was valued by participating families. In addition to these factors, dentists knowing when and where to refer a child to specialist dental services avoided delays to children getting the dental care that was appropriate for them outside of the high street dental setting. Clear and open communication seems to be the focal point of all discussions, a collaborative partnership that works in the best interest of all. It is important parents feel empowered to impart the knowledge about their children, but equally for the dental practice to ask the vital question, what do you think is going to work for you? If you have any questions about the study or would like to view the full report, you can email nicole.thomas@plymouth.ac.uk. Thank you for watching.